Okay, hello, I'm Samantha and I'm doing my heparin IV video. My scenario is of a patient named HAPS. He's only 16 years old and he's been diagnosed with acute pulmonary emboli. He's got a peripheral IV line and the doctor has ordered 2 different doses of heparin for him. Heparin 75 units per kilogram, IV loading dose now, and then heparin IV infusion 20 units per kilogram per hour after that. I figured out that we need to drop 0.75 mils of the loading dose and then mix it with 2 mils of normal saline, so then we can give it 2 mils over 2 minutes, or 0.5 mils per 30 seconds. And then the other one is a premix bag, so that's ready to go and needs to be set at 10 mils per hour. Okay, I'm going to wash my hands and get my meds drawn up. I'm using a TB syringe and we're using heparin 5,000 units per milliliter. So I'm going to draw up my 0.75 mils, inject that into here, and then draw up 0.75 mils of the medication. And have a second RN check that. Once that's confirmed, I can mix it with my 2 mils of normal saline. And discard that in the chart. And I'll recap this for now and just mix it lightly. And label it. With the medication, the date, the time, and my initials. Okay, and then I'm ready to go into my patient's room. Hello, Pat. Can you tell me your last name and your date of birth? Osmonson Smith, and it's December 18th. It's matches the on-band. I hear you've been having some trouble with an emboli, so the doctor's ordered some heparin for you. Have you ever had heparin before? Let me know. Do you have any allergies? You've got a sulfa allergies. Well, heparin is going to help in the future so your blood isn't clotting up so much, but it's not going to break up the clot that you've already had. So then I can clean off this tub for 30 seconds. And I figured that we're going to give this in the push pause method over 2 mils over 2 minutes. So, and after the 2 minutes, we can disconnect that and discard it. And then we're ready to do the slow loading dose that the doctor ordered. It's heparin 25,000 units per 250 mils. Oh, and I'm going to have an RN double check it with me to make sure that this is the right dose and everything. I'm also going to clean this tub off for 30 seconds. Mix it right up here because it's compatible with the D5W. Open up my clamp. I've got my D5W running at 25 mils an hour, and then my heparin is going to be running concurrently with the D5W at 10 mils an hour, so it's a total of 35 mils per hour. And I'm going to set the safety on the back so nothing can happen during the infusion. And then I need to teach my patient about this medication a little bit more. Pat, we don't want you flossing or brushing your teeth right now, and don't shave either, because the risk of bleeding is kind of high right now, and it's harder to stop your bleeding. And let any of the nurses know if you see your urine or stools are darker than normal. And I'm also going to make sure that there's nothing that he can bump that's next to him, because that can cause more internal bleeding easily. Okay.